Long-term care nurses say they are seeing their patients come alive.
Global News has learned of an AHS pilot project that seems to be drastically improving the lives of people with dementia. Su-Ling joins us now with more. Su-Ling, they're reducing the use of certain drugs.
Yes, anti-psychotic medications, which used to be the standard of care for many patients with dementia. Previous studies have shown 80% of patients on antipsychotics see no benefit. The drugs increase the risk of pneumonia, heart attack, and stroke. Now, long-term care facilities in our province will make them a last resort, restoring dignity to patients.
Ok, bonjour ma tante, ça va bien?
At 98 years old, one might expect Yvonne Verlinde to be getting weaker over time. Instead, her nephew recently noticed she was improving.
I was ready to help her, but she said, no, I could eat and drink by myself, and which really surprised me.
Yvonne has dementia and makes repetitive noises. For that, she was on Risperidol, an antipsychotic medication, for years. What changed a few months ago? She was taken off the drug.
Earlier days, I think we thought antipsychotic medications treated dementia. They actually don't.
Yvonne was part of an AHS pilot project involving 11 long-term care facilities across Alberta to reduce the use of antipsychotic drugs. Over the past year, St. Albert's Youville home has gone from 66 residents on antipsychotics to 5.
They're a chemical restraint. So there's something that's only needed if you're at risk to self or risk to others. So as we learned more, we developed other techniques of caring for residents that didn't involve drugs.
Nurse practitioner Gammon explains the drugs were prescribed for behaviors related to dementia, aggression, anxiety, sleep disorders. But by paying attention to individual needs and making simple changes, many of those behaviors improved.
We put teddy bears in their hands and used warm blankets. And instead of giving them antipsychotic drugs, those actually reduce the resistance to care.
The Youville team also moved bath times for some residents, gave many an afternoon nap, and let some sleep in. Covenant Health's Chris North says the results have been better than expected.
We've had a number of residents who are now, enjoying what they've enjoyed before, so playing the piano, knitting, recognizing their loved ones. We're seeing that the residents are coming alive.
Marcel Normandeau says his aunt's breathing is also better. She's doing things they never thought she would do again.
On her 98th birthday, she proceeded to read her birthday cards and thank all the persons individually. Again, another surprise.
Antipsychotic drug costs at the Youville home have gone from $3,300 a month to $200 a month. The initiative will now roll out to long-term care facilities across Alberta. And so last year in those 11 test sites, about 40% of the patients were on these drugs. They've now got that down to 20% or less.
This is quite a breakthrough, really.
No kidding.
It's
what
amazing.
Interesting.
Yeah, thanks, Su-Ling.
Thank you.
Health Matters is brought to you by the Stollery Children's Hospital Foundation, working with